So the title of my talk is called Dancing with Hope and Hopelessness While Healing Chronic Illness. How do I?
That doesn't work.
It's not?
It's just using mouse.
Okay. Got it. Okay, thank you. So this is me and the art that I've made exploring my experience with chronic illness. And this particular journey of mine started about 6 years ago when I was diagnosed with Lyme disease. And it's been a diagnosis that has radically shifted my identity and the course of my life. And since that diagnosis, and particularly in my time at Naropa, I've been inundated by helpful comments. Things like, you deal with pain, why don't you try meditating? What about mindfulness-based stress reduction, or writing in a gratitude journal, or positive affirmations? This is a community that believes in the mind-body connection, which I think is a beautiful thing. It's something I believe in too. And I do intend to explore the ways that this interface is imperative in understanding the development and healing of chronic conditions. But over time, I witnessed how these seemingly helpful comments have actually shifted my internal narrative of my own illness and introduced an element of self-blame, shame, frustration, and an additional sense of isolation. So as a therapist working with some others with chronic disease, I went into this presentation wanting to understand how can we help clients who might be hearing similar things to use the mind-body connection as something that can help them, but not to internalize it as a reason that their pain is their failure. I by no means have any answer to these questions, but this is where my exploration has taken me. So I know this is a presentation and not a paper, but I felt like the topics were really complex as I was compiling them, much like the experience of living or working with chronic disease. So before we dive in, I want to offer you a thesis and a roadmap of sorts of where we're going today. And I invite you to follow along on your handout if you're a visual learner. So, the medical community is beginning to acknowledge that emotions and thoughts, specifically those that provoke a stress response, both create and exacerbate chronic illness. This paradigm shift is beginning to acknowledge, this paradigm shift greatly impacts the social and personal narratives around chronic disease. They increase hope while at the same time increasing hopelessness and self-blame. Now, is that self-blame warranted? The majority of emotional reactions, thoughts, and stress responses that we have are actually subconscious patterns and habits that were formed in our early childhood. They happen automatically. So can we really say that illness is any one person's fault? I don't think so. Though it may not be our fault, however, it is our personal responsibility to change patterns so that healing is more accessible and to help us exert control in the places that we do have it. And it is our role as therapists to help clients to do this through working with the subconscious and nervous system and through increasing clients' sense of autonomy, acceptance, and hope. So I'm going to walk you through this, starting with the shifting mind-body paradigm, moving to the way that illness narratives are formed, and ending with a discussion of subconscious and nervous system type modalities and how to help people shift their own narratives. So the context I want to set is that of a changing healthcare system. Our healthcare system was originally created to address acute illnesses like broken bones, infections, things needing surgery, and it's having to shift and adapt to a more chronic care model to respond to the increase in chronic disease. So the top three here, heart disease, cancer, and diabetes, are among the 3 leading causes of death in the United States currently. And what follows is a long list of more rare but increasingly prevalent and debilitating conditions. These illnesses require different care needs, including behavioral management, how to help people increase healthful behaviors and decrease harmful ones, psychological services needed to help people cope with radical shifts in their life and lifestyle, and psychiatric ones to deal with the ensuing anxiety, depression, and suicidal ideation that can follow a diagnosis of this sort. So as this paradigm shifts, we notice an increase in the use of things like mindfulness-based stress reduction and yoga in settings like hospitals, and an increased interest in somatic psychological interventions and trauma work, like somatic experiencing or EMDR. Things that acknowledge the impact that our trauma, our emotions, and our thoughts have on our physical bodies. The scientific evidence for this comes from a new field of study called psychoneuroimmunology, which studies the way that our psychology, our thoughts and our feelings, then impact our nervous system, which then produces a physiological change in our immune system's capacity to function. And though it's still a burgeoning field with many contradictory findings, what is evident is that emotional stress does correlate to measurable physiological changes in our immune system, our brains, our hormones, and other organ systems. This fascinating body of research includes studies that examine populations like college students in exam week experiencing acute stress, caregivers who experience chronic stress over the long term, helping someone who is their loved one who's ill. Even studies for people who experience the subtle stress of social disruption, and people whose very personalities and their tendencies to be accommodating actually creates repression, which increases the stress load in the body. So this isn't just evident on a cellular level, but in the qualitative research of the renowned doctor and scholar Gabor Mate. And in his book, When the Body Says No, he writes about patterns he witnessed over time working with people with autoimmune diseases. For example, he writes about how patients with MS tend to have inhibited personality types and struggle to express their anger. Whereas on the other hand, people with IBS, irritable bowel syndrome, actually tend to exhibit hypervigilance and a fear of the unknown. So as I read this book, I found these correlations to be really fascinating, but I also found myself responding strongly to his findings. And when I read the following quote, I understood more about why that was. So he writes, "It is a sensitive matter to raise the possibility that the way that people have been conditioned to live their lives may contribute to their illness." So I want you to imagine for a second that the very thing that you struggle with, maybe it's depression, your body image, or severe mental illness. Now picture someone telling you that you created your reality and blaming you, in fact, for constructing the walls of your very jail. This is akin to the experience that I and other people who write about chronic illness have talked about when receiving well-meaning advice from the outside. The external narratives imposed by others tend to take two tracks. They go for the blame perspective, which increases an internal narrative of self-blame, or the shame and pity, which increases a narrative of victimization or helplessness. Oops. And these narratives are internalized in the ways that clients make sense of their illness. Many studies have been done on the narrative formation of people with illness because these narratives formed can directly impact their healing processes. The researcher Shatner writes, "The human need to create meaning is all the more pertinent when major life changes are concerned, which seem to wrest from our hands the control of our lives. Chronic illness is just such a change, and it is therefore not surprising that it generates compelling narratives as well as considerable research interest." So these narratives, These narratives impact how a client perceives their sense of control and whether they lean towards hope or hopelessness. They impact how likely a client is to manage their behavior in a positive way, or if the client will reach for help, be it medical or emotional or psychological. Finally, they impact the ways that clients make meaning of the past and determine how they chart their course forward. So on the one end of the spectrum, a study done on depression in lupus clients found that there are two ends of a spectrum, and those correlate to the two narratives offered by external comments. So on the one end, we have a narrative of low control. In this narrative, illness is cast as the oppressor and self as the victim that is at the mercy of the disease. This results in feelings of helplessness, grief, irritability, shock, dissociation, and apathy. And though it makes it easier for the patient to seek mental health help because they see themselves as a victim, it also means that they're more likely to slip into passive coping, which is associated with worse illness outcomes. The alternative narrative on the other side of the spectrum is one of high control, where illness is an adversary or challenge to overcome, and self is the warrior that must overcome it alone. And though this elicits hope and empowerment, it can also lead to exhaustion and burnout and a sense of shame when someone's best efforts to defeat this monumental mountain fails. What I've actually found, though, is that these two narratives aren't on polar ends of a spectrum, but tend to create this cycle of hope to hopelessness, to hope to hopelessness, which becomes exhausting both for the patient with the illness and for others around them, including perhaps you as their therapist. So the medical medium writes, "We can't take this amazing concept of harnessing thoughts for good and then use it against others or ourselves by saying that every negative thing that comes into our life is our fault. This is not the sort of thinking that leads to healing. It's the opposite. Blaming yourself for your illness is a major roadblock to getting better." But I believe neither one of these narratives is actually worth completely eliminating. Low control, when in excess, creates a sense of apathy and depression, but when it is in balance, it creates an opportunity to release and practice openness and acceptance. High control harnesses one's sense of autonomy and responsibility, but it can also lead to fatigue from working so hard to fix one's illness constantly, and self-blame when those efforts don't produce the desired product. So how can you help someone to decrease their self-blame while increasing their sense of acceptance, autonomy, and self-responsibility, and to either figure out how to navigate this cycle with elegance or to find the gray area in between these two narratives? I believe that one of the keys is to explain to them and to explore the role of the subconscious. So Gabor also says, there is not true responsibility without awareness. But how much awareness do we actually have in our lives? Think about this for a second. Do you think about which hand you reach for the toothbrush with in the morning? Do you think about how your body reacts when you receive a hug? Do you consciously pay attention to how your body responds to the honk of a horn? Most of the ways we react and navigate the world, much like Jordan was talking about in her presentation, is subconsciously programmed in our first 6 years of our life. Bruce Lipton, the scientist, explores this split between the subconscious and conscious brain. And he writes, when it comes to the sheer neurological processing abilities, the subconscious mind is more than 1,000,000 times more powerful than the conscious mind. So if these two minds are in conflict, which mind do you think will win out? You can repeat the positive affirmation that you are lovable over and over and over again, or that your cancer tumor will shrink. But if as a child you repeatedly heard that you are worthless and sickly, those messages programmed in your subconscious brain will undermine your best conscious efforts to change your life. So I think this is really important to acknowledge and introduce to clients to help them have some self-compassion for the ways that they might have helped create or continue to create their own pain and suffering. I also believe that one of the keys to helping them heal this is to use modalities that work with the subconscious explicitly to help clients to gain an increasing sense of awareness of the patterns that are keeping them stuck. For example, patterns they might realize in therapy are how they exhaust their immune systems by pushing themselves to care for others when they need to care for themselves. Or they might realize how a particular dangerous relationship keeps them in a state of hyperarousal, or how their marriage with an abusive father inadvertently has translated to their sense of safety with their partner. And this is, I love this quote, "The fish will be the last to discover water." This is sort of speaking to like how to help people understand the waters that they have swum in. I have a personal bias towards somatic modalities because training in Hakomi and working with it has been a big part of my personal healing. And I want to tell you a little bit about why I think it's particularly effective. A Hakomi practitioner, Helco Weiss, writes, "Body experience is also deeply rooted in the precognitive, nonverbal, and implicit realism or memory that we created in early childhood. So, when in the business of reconnecting, uncovering, and understanding the deeply held models of reality that form in those early years, it is the body that can most clearly and most quickly bring them into awareness, both emotionally and mentally. However you choose to access the subconscious, be it through dream work, art, wilderness therapy, or any of the other transpersonal modalities we talk a lot about here in this program, I think it's an essential part of helping clients to digest their learnings and to start practicing reversing destructive patterns. I also think it's important to help reverse these patterns on a cellular and physical level. So I believe a lot in referring out and collaborating with other modalities that work with the nervous system and the body. And listed up here and on your sheet are just a few examples of ones that I've found to be particularly effective. So you might be thinking, well, I'm a therapist and I don't do Hakomi or practice, mind-body interventions. What can I do if I have someone walk into my office who's struggling with these topics? And the biggest takeaway that I want you to walk away from is, how can I increase acceptance and self-responsibility while decreasing shame? And to acknowledge the complexity of these topics. But I also want you to have some concrete ideas of themes that might arise and themes that you can point people to. So the first one, and these come from Gabor's book as well. The first one is acceptance. So how to help them to create an acceptance of their current state, the shifts in their identity and the shifts in their real life practical experience. How do you increase their awareness of their body sensations, help them learn when they need to say no, to rest, to pay attention? How do you increase their awareness of the habitual patterns that do keep them stuck? And we talked a little bit about using somatic modalities or mindfulness techniques to do that. How do you help them to contact and acknowledge their anger? As we talked about earlier, repression of anger increases a lot of stress in the physiology of our bodies. And also, how can you help them to harness an expression of anger, to set boundaries with others who might be demanding too much of them, or with caregivers who have ideas about their care and aren't listening to their own voice? Thank you. Fourth is autonomy. So how can you help people to gain a sense of self-control and self-responsibility in a healthy way? Attachment. This is a really hard road to walk alone. So how can you help people to understand the blocks they might have in reaching for help and support, and to work through them so they can really create a helpful support network around them? Assertion. So again, this goes a little bit with anger and setting healthy boundaries. How can you help people to assert their needs and ask for what they need in the medical community and also just in their day-to-day life, maybe even in their work environment? And finally, affirmation. So as you notice clients making new choices that put them in a more healthy, positive direction, how can you really affirm their choices and support them in creating a sense of self-empowerment and self-appreciation? So finally, just want to say thank you to Naropa and to my other buddies. This presentation comes from a lot of my personal experience, and a lot of that has been supported by the container and the people that I've encountered here. Thank you. That's it. I'll go back to the beginning. That's prettier.
Can you talk a bit about your art process?
Yeah.
These photos, because they're amazing.
Yeah. Thanks for asking that. So I think a lot of you know this, but I started creating art at the beginning of my diagnosis actually as a way to process the emotions coming up for me that I felt I couldn't articulate to the people in my life, but I could show them a picture of, and they would maybe get something more about what was happening inside me. And then about 1.5 years ago, I decided to start creating an Instagram to share it as a form of raising awareness for chronic illness. And so that has been a really healing experience in itself and taught me a lot about how these hidden parts of ourselves need to be seen, whether it be through sharing art or just through sharing stories and narratives. Yes, ma'am.
Has doing this presentation and all the research that came along with it and what you learned from it changed the way that you're relating to your own chronic?
Yeah, it definitely has. The piece that I left out for time was that the cyclic nature of the hope to hopelessness is something that I've been watching in some of the clients I have who have illness. But it's really something that it comes from deep personal experience. And I've noticed that the more that I've gained a sense of self-compassion, the gentler that cycle feels to me. And it also feels like I do have an increased awareness of what I can do and what is important to focus my energy on. And that has been empowering. And I feel like I get stuck less in the depressed, apathetic place because of that.
I know you don't have an ultimate answer to this, but I have a client who's struggling to decide whether or not to bring her chronic illness as like a disability so that she can take time off from work and get those ADA kind of benefits of having disability, but then she's wondering what all the downsides to that would be and how much that will follow her. Do you have any things about that?
So I don't necessarily have ideas on a practical level. On an emotional one, I'm smiling because this is a conversation that I've had many times with other people with illness about like how it changes our ability to heal when we over-identify with illness. And I think that's in the presentation, I don't necessarily personally think that identifying as having illness is the problem. I think it's that state of victimization that it gives some people that is the problem and getting stuck there. Does that make sense?
Yeah.
And so like I think there is a way to own it and receive the support and disability that owning it allows you without getting stuck in that. And so if she does go ahead and do that, that's something I would watch for in long-term work with her, is if she's taking on the victim role. Yeah. Anyone? Cool. Thanks, guys.